Hello, FACES students. This is Dr. Magaña, pediatrician and founding director of the Faces for the Future Coalition. I am here for part 2 of COVID Q&A, and we now have 2 questions coming from Ellie, our FACES scholar from our Denver program, and she has 2 really great questions. The first question she has and poses is, with Omicron, they are saying it stays in your throat. Does that mean that the nasal swab for home tests are not as reliable? That's a great question, Ellie, and I can see where there might be confusion around that because there's been a lot of reports to the public that have said that those people who have been infected with the Omicron generally have milder disease. In other words, it resembles more like a cold. And so therefore it would primarily maybe present as a sore throat and runny nose, something like it has a head cold. While that is true in some cases, it's important to note that Omicron does not just stay in the throat or in the upper airway. And in fact, particularly in people who are unvaccinated or people who have completed the first set of shots, the primary shots, but haven't been boosted, Omicron and COVID continue to cause fairly significant disease, some leading to hospitalizations. And so that means that the Omicron virus can absolutely infect other areas of the body beyond the throat. So therefore, it is important to know that nasal swabs, which is the traditional way of testing for COVID, whether it be the home tests or the PCR tests, which are often done in clinics and in community outreach centers, that kind of swabbing is actually quite sensitive to pick up the Omicron virus. The other thing too is that the machines which currently test for the Omicron were not validated for oral swabs, meaning swabbing the back of the throat. So while it may be being done in other countries, right, and parts of the world, it is not currently being done in the United States on a regular basis, nor is it recommended as a regular routine. So having said that, it's important to continue to trust that the nasal swab, which is done both for the home rapid tests and the PCRs, is still the recommended way of testing for COVID, including Omicron. And yes, it is absolutely sensitive and will pick up the Omicron virus as well. So that's a great question. The second question that Ali poses is, people are saying that you can mix and match the vaccinations and the boosters. And some are saying it's actually better to mix and match the primary, which is the first 2 in case of Pfizer and Moderna, or the 1 in case of J&J, to mix and match the primaries with the boosters. So what information can I provide about getting different brands of vaccines and boosters? So first of all, let me remind you that I get all of my information from the Center for Disease Control, which is the most reliable source of information regarding the COVID vaccine. And currently, it is important for everybody to receive their booster vaccines. And why is that? Because the research has shown that in most cases, people who have received and completed their primary doses, the very first 2 or the first 1 in case of J&J, is that protection decreases and wanes several months after receiving those doses, which makes you vulnerable to getting sick to COVID, including Omicron. So boosting or receiving your booster vaccination actually has 2 advantages. It actually increases your protection about 10 times more once you receive the primary series, and the boosters actually do protect you against the Omicron variant right now. So it is very important to do that. Now, one question related to this that I've heard is, well, if I get sick with Omicron, does that mean I don't need to get my booster, that I am protected now from getting sick? And the research pretty much says that no, actually receiving the booster, even if you have already gotten sick with the Omicron, actually imparts greater protection and immunity than having gotten sick with the virus itself. So the current recommendation is please get your boosters. Now, who's eligible? Well, you have to be clear on what the age ranges are and what the current recommendations. So if you got the Pfizer vaccine as your primary series, your first two, the current recommendations are that anybody 12 years and older is currently eligible to receive the booster vaccine, as long as it's 5 months after the second vaccine. Okay. Now remember, the Pfizer vaccine is the only one that has been approved as a booster for kids between the ages of 12 and 17. So if you're between the ages of 12 and 17, Pfizer is the only vaccine you can receive as a booster. Now, if you receive the Moderna vaccine as your primary vaccinations, anybody over the age of 18 is eligible for a booster. Again, as long as it's been 5 months after getting your second Moderna vaccine. And if you received your J&J as your primary vaccine, anybody over 18 years old is eligible for a booster, as long as it's been 2 months since your first dose of J&J. Now, what about mixing and matching? Well, there's no clear research, as I understand it, that shows that mixing and matching is actually, mixing the boosters with the primary is actually more advantageous than receiving the same vaccine as you did. There's some suggestion that maybe there might be an effect, but there's no clear guidelines around that right now. What is clear, and this is the most important thing, is that regardless of whether you mix or you match the booster to the original shot you got, it doesn't really matter as long as you get the booster, because the booster has definitely been shown to increase your protection and reboot your immunity against getting severe disease if you are infected with the Omicron variant or COVID. And we have to remember that currently right now in January of 2022, the Omicron variant is the primary virus, which is infecting most people in most communities. So I hope that answers your questions. Please continue to do the great work you're doing. I want to applaud all of you who are working on our COVID vaccination outreach project and doing the great work on health education and really encouraging people to get the vaccine and their boosters. We need to slow down the progression of this and really support the health and the well-being of our communities. And you all are playing a vital role in making that happen. Keep your questions coming. And if there's any clarification that you need about anything I've said, please reach out to the coalition and let me know. Thank you all and best of luck. Bye-bye.